Like every other state in the Union, you had, with some of the drawdown in mental health funds, state after state after state, you had more people seeking mental health treatment who were going to hospital ERs. Well, it's certainly a place where treatment can be provided. It's not the ideal place.
Several problems would arise in the emergency room. Not only would the emergency room doctor not be an expert in behavioral health care and so might not know what the best medication treatments might be or what the next steps might be, and didn't have a psychiatrist that they could really call onto the site because many of these were rural areas.
For a number of years in South Carolina, patients seeking mental health treatment would have to wait an average of 2 to 3 days before being assessed by a psychiatrist. On a typical Monday morning, more than 85 people were waiting in the state's emergency rooms for psychiatric exams.
So my sense was that there was too much of that going on here in South Carolina. We were not going to be able to solve it with just state funds. So to wit, that's what led us to go up to the Duke Endowment and say, could you help us fund a way to put a greater capacity in hospital ERs around the state, principally in the rural small hospitals, because those are the ones that needed the most help. But essentially any hospital ER that wanted our help, we were willing to go in, partner with them, and try to provide the help.
So when you think about providing mental health services to people who live in very rural areas, the idea is to do it to increase access, to maintain quality, and to make sure that night or day, 24/7, including weekends and holidays, there is a doctor available. So we decided to go statewide with Telepsychiatry, which is the mental health aspect of telemedicine or telehealth.
Are you okay talking with me?
Yes.
Whenever we have patients that are acutely psychotic or depressed, suicidal, homicidal, anything that we deem that the patient needs to have be a referral or have a consultation with a psychiatrist, we have that service available to be able to get that consult here locally. If we do decide that the patient is an imminent harm or danger to themselves, we remove anything that could be of danger from them, their clothing, we put them in paper scrubs, and we place them here in our emergency department holding area.
At this point, the hospital will request a telepsychiatry consultation. Psychiatrists working on a rotating basis with the South Carolina Department of Mental Health will pick the patient's name off an electronic queue sent by the local hospital. The facility may also send electronic medical information about the patient, so the psychiatrist can review the information before the actual consultation.
Once they bring the patient into the room and we've done the informed consent, we want to hear from the patient what led to their coming to the emergency room, to get the details of it and not just, they had a suicide attempt, but what was going on. And we want to make sure that anything we recommend, the patient feels they can implement. So if we recommend medication, are they willing to take it? Are they able to access it? We can't look all around the room, up and down, and zoom in on the patient, so we have a really good view of the patient, the same way we would have if we were in there with them in person. And it's very acceptable to patients, even patients who are pretty psychotic and can't watch TV at home, can use this equipment, and I read that in the literature and I found it hard to believe, but that's been our experience.
And do you take any medicine regularly, any prescription or over-the-counter medicine that you take?
No medical problems.
And a lot of times, if there's a barrier to actually getting the patient placed, we can go ahead and start them on the treatment that's been recommended by the psychiatrist. So because this is in place, it allows us to go ahead and start treatment and not just have the patient sitting here.
From 2011 to 2016, the Department of Mental Health has completed over 30,000 statewide telepsychiatry consultations. The program has drastically decreased patients' waiting time from 2 to 3 days to an average of only 8.5 hours.
We have to say that the program is a distinct success in terms of identifying, seeing, and serving patients in the emergency department.
Once discharged, patients who participate in a telepsychiatry consultation utilize community aftercare treatment at twice the rate of patients not receiving telepsychiatry consultations. These direct patient benefits are in addition to creating a more efficient emergency room experience.
Emergency rooms are set up for the doctors to be in and out, assess you, order something, assess that, come back, talk to you, make a decision, transfer you out. But you can't do that in the mental health field. It takes a little bit longer, and patients will say, thank you for, hearing the whole story.